And now, last but not least, although we are substantially behind schedule, I have the pleasure of having a short interview with a colleague from the water industry, someone that we've been actively in touch with in recent years, Mr. Filip Wanner from ENERGIE AG BOHEMIA. We invited Filip, particularly as a conclusive speaker, in order to give us a quick overview and some insights into the EU water regulations, and more specifically the Urban Wastewater Treatment Directive that is under revision. And very recently, a couple of weeks ago, we got the proposals from the Commission. I'll try not to limit the discussion to the Urban Wastewater Treatment Directive. So, Filip, whatever other thoughts and angles to the topic, particularly in the context of our overall event today, antibiotics, wastewater treatment, and specifically in this direction of resolving partially or fully the issue with residual antimicrobials in water. Alistair emphasized at the end of his talk a minute ago that policy and regulation alone will not solve the issue, but still, for good or bad, they are a hugely important topic in the area of water, at least in the European Union. We're very glad that today we have speakers from extremely diverse area, the US, Mexico, a number of European countries like Spain, Austria, and some others, but also the Middle East. And now we'll finish with the EU regulations. And with that, welcome to you, Filip.
Hello.
Yep, we see you, we hear you. Thank you for being with us. I would like to first give you we'll conduct this as an interview. And I would first like to give you the floor to briefly introduce the Urban Wastewater Treatment Directive. What are the key new moments in this document? How do you see it coming? And particularly in the context of the topic that we are discussing today. Over to you.
Okay, thank you. So Urban Wastewater Treatment Directive is one of the most important directives or legislation framework for the water utilities in the field of wastewater treatment. And as you said previously, the new proposal was presented a couple of weeks ago. So this is a complex new proposal, and there are a lot of proposals, a lot of changes, but we can divide it into two main branches. One is dealing with the so-called remaining pollutions, like traditional. We are dealing many years like nitrogen, phosphorus, organic compounds described like COD or BOD. That's one task to increase the efficiency of wastewater treatment, not only in the wastewater treatment plants, but only, for example, in urban runoffs and severe stormwater overflows. On the other hand, the scope is quite improving or extending to the so-called new challenges, like, for example, the pharmaceuticals, which are actually mentioned in this proposal. And also it's dealing with things like circular economy, recycle of water, and valuable materials presented in the wastewater and in the sludge. And also it's dealing with I think most important topic with the climate change and trying to reach so-called energy neutrality of the wastewater treatment plants.
Okay, you actually answered my second question, which was about the type of pollutants that the new directive addresses. So you pretty much gave a good answer that more stringent requirements to existing parameters, but also introducing new ones. One, I will slightly broaden our chat, Filip. in addition to the Urban Wastewater Treatment Directive, what other pieces of EU legislation in the area of water and environment, I mean, cover the topic of antimicrobial resistance? Where else do we need to look at, if anywhere?
Of course, we have to look it even in the drinking water directive, of course, and one of the most important in the water sector is the Water Framework Directive, which actually covers the quality of the surface water, and it's in the case most important directive, and sometimes there is a discussion what should be priority of, for example, water utilities, if to look after urban wastewater treatment directive or even to fulfill the quality standards described in this water framework directive.
Thank you. So a combination of directives tackle these issues, which can be expected. I mean, there are quite a few pieces of legislation related to water and sanitation. Filip, I mean, in your daily work, you are helping your company, which is actually a group of water companies in Central Europe, to address the regulations. Is it going to be very costly for water utilities and to societies in general to comply with these new regulations?
If we are looking for all the targets which are described in this proposal, I'm afraid it will be quite costly for all of us. Even the material of the European Commission presented together with this proposal, it says that in the end of 2040, which is the final time target for fulfilling all the goals, it says it will cost about 3.9 billion of euros per year. On the other hand, they are calculating the benefits gained by this fulfilling all the targets, approximately about 6 billion of euros. So they are suggesting that the costs are worthy to pay for us. What's quite interesting and what's quite important, who will actually pay these costs? So they are estimating that about 50% of these costs will be paid by the customers in the water tariffs, about 21% by the local or national governments by the budgets. And what's quite important, there is estimated that about 28% of the costs will be covered by the so-called extended producer responsibility scheme. And this is quite in touch with this pharmaceutical industry, because as I told before, one of the pollutants which are now looking for even in this urban wastewater treatment directive is a set of these pharmaceuticals and personal care products.
It will be interesting to see how the big pharmaceutical company will be charged for one more stage of disinfection in wastewater treatment plants, but hopefully it can happen.
It's actually the proposed idea. There is a list of pharmaceuticals, even some of them which we are actually were talking about, for example, carbamazepine, diclofenac, venlafaxine, and etc. They have set the target of reducing of 80%, and these costs for additional wastewater treatment to meet this 80% treatment efficiency is actually proposed to be financed or funded by these environmental funds, which these pharmaceuticals who will place their products on the market will have to contribute to these funds.
I can imagine this will create quite a lot of work for people involved in tariff setting, regulations, national policy schemes. As we know, that's quite a complicated arena. One more question I want to ping to you in an area that is different than AMR. The secondary topic of today was water reuse and treating water for reuse, particularly for irrigation, but also to standards that qualified for potable, for drinking purposes. My question, I mean, most of your experience is in Central and I would say even Northern Europe, in Czechia, in Austria. Do you think that countries that are not dry should be required to reuse water?
It depends on the situation and even for the cost-benefit analysis, but I think even for the not so dry countries, for example, for irrigation or street cleaning or watering the parks, it's not necessary to use the fresh drinking water, which sometimes is treated, for example, by activated carbon filtration or any other quite cost treatment techniques. So therefore, it's not necessary to use in every scale this quite costly treated drinking water. Therefore, I am suggesting it's quite a good idea to use this water reuse as much as is possible, even in the not so dry countries.
Thank you for that. That was a useful insight that it's not only down to irrigation, but as we know, quite a big fraction of even the potable water goes for purposes that definitely do not require potable water. My last question, Filip, is related to policy-oriented research and other areas of regulation and policies. Which, in your opinion, are the areas that in the next 10, 15, 20 years need to be more deeply researched before they become regulations in the water sector, I mean?
Okay, so there is, for example, one proposal in this directive to recycle nitrogen and phosphorus from the wastewater and from the sludge. There is also said that the European Commission can propose their own delegated act, which will describe the techniques, but and the minimum sets of the recycling of these substances. But I'm afraid that in this moment there is not such a viable technology for recycle nitrogen and phosphorus from the sludge to be economically viable and economically usable on a regular basis. So in some point these are just the proposals, but the technologies are not ready yet for such recycle of this nitrogen and phosphorus.
Thank you. So your answer is quite clear. I mean, circulation of nutrients, nitrogen and phosphorus more specifically, and a topic that is very much into the water and a big cost driver for wastewater treatment plants as well. So thank you for that, Filip. If you want to share some final thoughts on EU regulations and water in general, you are welcome.
I think it will be quite challenging for all the members on the European level. The proposal is just proposal, so there will be about 1 or 1.5 years of approving this directive. Then there will be another, let's say, 1 or 2 years of transposing this directive into national legislation. Then maybe this is just the first information to all of you that the new proposal, which is quite huge for our water sector, is on the way, and keep updated by our national organization, national government, what's the current status of this directive.
Thanks a lot, Filip. That was useful and something that I forgot to ask you in the beginning. I mean, when and how do we expect this to actually become a norm that we would need to comply with, as opposed to a document that is subject to reviews and comments as we are in the moment? Thanks, Filip. Appreciate it. I mean, we will keep calling you for future biotech ateliers in which we want to understand how the regulations stand, at least at the European level. Appreciate it.
Okay, you're welcome.
Thanks a lot. And with that, I think we finished all our panelists for today, interviews, keynote speakers, and everyone. We had 3 good panels with 3 or 4 speakers in each, 3 interim keynote speakers, and now Filip giving us an interview and some insights into the regulations. I hope that gave all of our the listeners to this event a nice overview of a topic that we've been planning for some time to get more deeply into. AMR, antimicrobial resistance, the presence of antibiotics in water, and some related water treatment and water reuse topics. I would like to thank the team that organizes that. I mean, under the brand of Biotech Atelier, that includes our key sponsor, which is Biocampus Sofia, some contributors like Invest Sofia, and our partners from Parallax and Vangavis. It's quite a team that we have behind the Zoom. And with that, I would actually like to pass the floor to the better looking part of our team, the ladies in the office who are behind the smooth organization of everything. So Monica, Teddy, Gergana, let us see you and hear the conclusive words from you.